So let's begin with our lecture of pancreatic neuroendocrine tumors. And in the first section of this lecture, we will talk about the overview. What is pancreatic neuroendocrine tumors? And then we will talk about the gastrinomas and how we diagnose and treat the gastrinomas. Pancreatic neuroendocrine tumors. Whenever you see the word endocrine, it has to do something with the hormonal state or hormones of the body. So in this case, the pancreatic neuroendocrine, so the hormones which are associated with the pancreas or different chemicals produced by the pancreas are associated with the pancreatic neuroendocrine tumors. So it's the hormone excess state. Pancreatic neuroendocrine tumors are the a hormone excess state. It can be functional type. The functional type of these tumors, they are associated with very severe symptoms of the hormone excess, and they are usually the small primary tumors, which are the functional tumors, and they are associated with severe symptoms. And the primary tumors are the tumors which are not secondary from other sites. They develop primarily in the pancreas, and they are small in size. The non-functional type of neuroendocrine tumors, they present late with large tumors. They are large and they are metastatic because the functional ones are the primary tumors, means they develop from the pancreas, primary in the pancreas, small in size, as compared non-functional are large in size and they are metastatic in from the different areas. So this is the pancreas and there is a tumor in the pancreas. So two important differences. It can be functional neuroendocrine tumors. It can be non-functional. Functionals are associated with severe symptoms or features, and they have small primary tumors, whereas non-functional, they present late and they are large and they are metastatic. Next, the treatment of the pancreatic neuroendocrine tumors. We have two different strategies for the treatment. First strategy for the treatment is directed at hormone excess state. We already mentioned these neuroendocrine tumors are the hormone excess states. So first strategy is towards the hormone excess, which is causing all the features. So gastric acid hypersecretion, which are gastrinomas, hypoglycemia in insulinomas, life-threatening complications. So first treatment strategy is toward the hormone excess. What happens in gastrinomas? Excess gastrin or acid production is occurring. We had high hypergastric acid secretion, and then the aim of the treatment is to treat that acid or gastrin excess secretion, acid excess secretion, so that avoids some of the symptoms or prevents some severity of the symptoms. Similarly, in insulinomas, we have high level of insulin that is causing the low blood glucose level. Hypoglycemia should be managed, and this management can prevent some life-threatening complications that can occur. The other second strategy for the treatment is directed against the tumor, many are not surgically curable. So second strategies, we are directed against the tumor, not the hormone excess, and then most of these tumors are not surgically curable. Most of the pancreatic tumors, usually at diagnosis, they are already at advanced stage. Surgery is usually not recommended for those type of tumors because they are extensive or spread metastatic already. So the surgery is, many are not surgically curable, and the surgery is mostly not recommended. So two treatment options. In first, we go for the hormone excess, try to bring a normal level, and then the other is towards the tumor. First, the gastrinoma. What's the gastrinoma? What's the features of the gastrinoma? And gastrinoma causes Zollinger-Ellison syndrome. So gastrinoma is Zollinger-Ellison syndrome. It is a neuroendocrine tumor that secretes gastrin. As the name shows, gastrinoma, it's the tumor of gastrin producing tumor that secretes gastrin. Chronic hypergastrinemia results in marked gastric acid hypersecretion and growth of gastric mucosa with increased number of parietal cells and proliferation of gastric ECL cell. So this is gastrinoma. It's the gastrin producing tumor that produce excess gastrin, and that excess gastrin cause hypersecretion of acid in the stomach and causes growth of gastric mucosa with increased number of parietal cell and ECL cells. Hyperparathyroidism in Zollinger-Ellison syndrome, along with hypergastrinemia, there is also hyperparathyroidism. Gastroesophageal reflux. Gastroesophageal reflux is the food from the stomach goes back into the esophagus that causes the heartburn, or causes the sometimes chronic gastroesophageal reflux is also associated with complications like stenosis and different conditions. So hyperparathyroidism and gastroesophageal reflux. So gastrinoma is also Zollinger-Ellison syndrome. Peptic ulcer disease, H. pylori, abdominal pain and diarrhea, duodenal ulcer and MAN1, which is multiple endocrine neoplasia type 1, 60 to 90% are malignant and distant spread to bone, liver metastasis. So gastrinomas, we know there is excessive secretion of acid, gastric acid. That gastric acid causes ulcer formation. So there is peptic ulcer disease associated with gastrinoma that causes very bad abdominal pain, especially in the epigastric region. And then there is diarrhea, duodenal ulcer, MAN1. 60 to 90% of gastrinomas are malignant and they can spread to liver. Metastasis to liver is also present. Diagnosis of the gastrinomas, there is demonstrating inappropriate fasting, hypergastrinemia. Hypergastrinemia is present in gastrinoma. So inappropriate fasting, hypergastrinemia. Basal gastric acid output is also used for the diagnosis. Diagnosis after retained antrum syndrome. Secretin provocative test. Commercial gastrin kits are also available that measures the level of the gastrin. So all these are the different tests that are used for the diagnosis of the Zollinger-Ellison syndrome or gastrinoma. PPI's false negative diagnosis. Certain drugs prevent the secretion of the gastrin. So these are proton pumps inhibitors. Proton pump inhibitors. They have false negative diagnosis, and then certain drugs are also used that prevent the secretion of the gastrin. So different tests are available for diagnosis. Treatment of the gastrinomas, we have oral gastric anti-secretory drugs that try to lower the level of the gastric acid secretion, gastrin secretion to relieve the patient of the symptoms of the heartburn, abdominal pain. Then proton pumps inhibitor, hydrogen potassium ATPase inhibitors are also used. Histamine H2 receptor antagonists are very, very effective drugs for the treatment of hypergastric secretion, gastric acid secretion. So histamine H2 receptor antagonist. Surgical resection is another treatment option. So all these are the treatments used for the treatment of gastrinoma, Zollinger-Ellison syndrome, which is a condition in which there is increased gastrin production and causes hypersecretion of gastric acid, leading to different conditions including the peptic ulcer disease. There is also associated with diarrhea, abdominal pain, and the different diagnostic tests are available for the diagnosis of gastrinoma, and the treatment options are H2 receptor antagonists, proton pump inhibitors, oral gastric anti-secretory drugs, and surgical resection is also the option for the treatment. So that was all about the section 1 gastrinomas. Thank you for watching sqadia.com.